Hello, good day. Today I'm here with Lisa Logan for our KMK video blog. Lisa recently joined a KMK consultant and is an assistant principal for our market research team. Welcome, Lisa.
Thank you. Thanks so much for having me. Excited for
Sure.
our conversation.
Yeah, so Lisa just recently joined KMK, and she brings a wealth of oncology market research experience. And so today I wanted to chat with her a little bit about her experiences and knowledge of market research and understand a little bit about what's unique in this space. So Lisa, yeah, I know that market research can typically have a pattern, if you will, but I think because of the complexities of oncology, it can be a little bit different. I'm interested in your perspective on that.
Yeah, so I started off my career just in healthcare in general. So had exposure to, diabetes research and asthma, and those are complicated areas because of the heritage that a lot of products have in the space and, what it takes to introduce a new mechanism of action and things like that. But what's really interesting about oncology is that it just gets so much deeper, and there's so much more that you need to know about a therapy area, about a specific tumor type. And a lot of times what you know in one tumor type will not transfer to another tumor type. So even though it might seem like, if you know breast cancer, maybe you'll know AML, it's not true at all. There's a completely different way of looking at it, completely different lingo, completely different way of treating and mechanism of action that you need to use for different products. So that was kind of the first thing that stuck out to me when I started in oncology so many years ago. Now that I've been in it for 10 years, it is really interesting to see how quickly the science changes and how on top of it, you have to be on top of the news and, attending the conferences, stay up on what's kind of happening. Because these new technologies and new pathways enter, maybe immuno-oncology is probably the best place to start, where even 5 years ago, we weren't hearing anything about it. And now, Keytruda, Opdivo, Tecentriq are just dominating,
Right.
solid tumors and CAR therapies in the liquid tumor space. So it's an interesting area, a lot that you need to kind of learn about and stay on top of, really complicated.
Yeah, and that leads me to the question. So I think about people that are on the other side, like, for example, doctors, right? And the space is changing quickly for them as well. And so it seems to me that that's a real prevalent need for understanding market research, because we need to understand how the perception of people that are also being exposed to all of these rapid changes are reacting, right?
Right.
Yeah, that's very interesting. And there's a lot of different people a lot of different actors, right, that are participating in a decision-making process that a pharmaceutical company cares about. So the process is a little unique in terms of your approach to performing a study or an overall perspective, I would think. What's that like compared to, just
Yeah. Well, it's interesting because a lot of times, patients they're involved, but, a lot of times, especially in first diagnosis, they don't have the level of information or understanding that they would need to make a treatment decision. So they are really heavily reliant on their physicians. A lot of times payers weigh heavily in because these are really expensive treatments. And so you need to know what's going to be, how things are going to be covered. And there's a lot of kind of cost efficacy trade-offs that are happening on a much higher level than, the typical market research respondent that we would speak to. And then, nurses are crucial in a lot of these different therapy areas because, some of the treatments that require infusions and have really severe side effects that nurses need to manage, they can weigh pretty heavily into treatment decisions as well. If there's something that they feel uncomfortable with, or if they've seen, a lot of patients struggling with a specific side effect, their voice can carry a lot of weight with an oncologist or a hemonc for prescribing treatments as well. So it's kind of, we also speak to pharmacists, and, caregivers can have a really huge role here. especially in the metastatic setting, or for patients who have, relapsed or gone down a long road of treatment. So yes, you're exactly right. There's a lot more stakeholders involved here, and a number of different people that kind of can weigh in, depending on, the severity of the disease or where a patient is, their level of
Right.
knowledge or the education that they've, given themselves, and how willing they are to kind of fight back with their doctor about treatments and things like that. So there's a lot to unpick and unpack.
Right. Yeah,
Yeah.
it's less about, well, the doctor prescribes something and it either works or doesn't, so they're going to pick the best thing that works. It's more, there's a side effect that could be significant enough that will guide a doctor's decision to another direction, and that plays very heavily, I would think, into
Exactly.
the importance of how a drug is going to be aligned. So that's very interesting.
Yeah. And in the metastatic setting, it's doctors might feel like they're gambling. They might not know what's going to work well for a patient. And I can't imagine having that, hanging over your head and not being sure if the treatment that you chose is going to be the right one. And so I do think that they are, they feel an insecurity. There's a whole emotional aspect that goes along with it as well, which is really interesting to
Right,
how
right.
that.
And that the market's very competitive as well, too.
Mm.
So there's that's going to, I think, play into the branding, the positioning, the how do you differentiate.
Mm.
And I would think that market research within the space really aligns a lot of those components much better than the hard data, if you will, right?
Yeah, it's interesting because maybe lung cancer is a really good example to look at right now because there's a lot of targeted therapies. So if you just look at ALK, for example, patients who exhibit that mutation, I think there's like 5 or 6 different ALK inhibitors that you could choose to treat that. But it's a very small, 5% or less of patients who exhibit that mutation. So you're kind of going after a small market with all of these different competitors. Luckily those can be sequenced and, depending on a doctor's comfort level or all these other factors that kind of go into play. But that's a competitive space right there. And then on the other side, you have all these IO treatments that have really shown great efficacy in the lung cancer and non-small cell lung cancer space. But you're not able to sequence those. So it is a real heavy competition there with, Keytruda, Opdivo, Tecentriq, all the others that are kind of out. And yeah, you need to really unpick how are you going to get past the, the Keytruda kind of Goliath at this moment if you're in the lung cancer space. You only have one shot really to get that doctor on board with it, or to get that patient on the
Right.
IO therapy. So yeah, there's a lot of work that needs to be done to understand where the opportunities are and how you
Sure.
can win.
Sure. Sure. Interesting. So, and as we've seen the whole space continue to evolve, it seems to continue to get more and more personalized. With some of the gene therapy that comes out and some of the really specific drugs that are pretty much manufactured to suit the need, right? How does that affect the future of the market research? It's just in your eyes, and it's an open question, but I don't think it's a right answer, but it's kind of interesting.
Yeah.
Where's this going, right?
It's so funny because when I first started my career, personalized meant targeting a tumor mutation. So like I was just
Right.
saying now, and that was personalized medicine. But now you think of personalized with it, thinking about like an immune system or a genetic code. And the drugs are not personalized per se, because it's one drug that's doing all these things. The response is personalized to that individual, which is a really different way of kind of thinking about personalized treatment from when I first started in oncology. So it's such a funny kind of switch that we've seen. And just going back to your previous point, like these are really complicated things that drugs are doing these days. And, I just attended a webinar last week where they were talking about, using CRISPR technology and changing genetic code and things like that. And I can imagine, for some oncologists, it's hard to like wrap your head around and stay on top of what the newest, it's technology at this point, it's almost gone
Yeah.
beyond medicine. It's like using, real like lab science to make these medications and to figure out how they work.
Sure.
So yeah, it's a really interesting idea of where personalized has kind of moved to, being
I
with
know.
it.
And
Yeah.
and all the knowledge that you gain with all these studies, you're going to be able to open your own practice in next year, week or two, right?
Oh man, I know. My mom would be so excited.
Anyways, well, this was just a preview of some of the areas that we're seeing as a trend in the market research in the oncology space. Lisa, I want to thank you for your insights here. If if anybody is interested in learning more, please reach out to KMK Consulting. We'd be happy to talk. Lisa, thanks for being with us today.
Thanks so much. This was fun. Appreciate it, Rob.
All right, and have a good day.